Blessings, everyone, and peace and greetings. Thank you for joining my Aisha Speaks Jade Facebook motivational page, where I am no other than Aisha, also affectionately known as Jade. So I'm still catching up, good people, but I'm doing really good. I'm feeling better, so I'm able to project a little bit better. I try to give you good content, and hopefully it is appreciated and you use it not only for your own personal life, but you can share the knowledge and understanding. So I am finally done with the month of September because a lot of you guys know that I was on vacation and I really didn't do too much as far as, um, you know, doing audios or anything like that. I did a little bit out. I may have done one or two and shown my face, but really the goal was to just kind of really enjoy myself and try to relax as much as possible. Then got back and ate some food that made me sick. And I really think that I got a touch of, just like a touch of food poisoning, but it really had me just like locked down. But nevertheless, in moving forward, it's a better day today. And I am officially in the month of October with making up live audios. So welcome to my makeup live audio for Monday, October the 1st, 2018. And I would like to, for the rest of this week anyway, to bring some October awareness for 2018. There is so much awareness out here that I'm not able to cover all of it. Maybe one day I will actually do a whole month of awareness. Not sure when that's going to be, but you never know with me. But as of right now, I'm just going to do for this week, the first week of October. And so again, this is a makeup live audio for Monday, October the 1st, 2018. So we are in a new month and I'm just going to bring a little bit to you. So for this live audio, I want to speak about the awareness of Health Literacy Month. Again, it's called Health Literacy Month, which this particular awareness is going to be for the whole month of October, which is from October the 1st through the 31st. I've never even heard of a health literacy month, but we're all learning through experience. So if you hear any noise in the background, it's just giving me all these wonderful alerts, so I apologize. So this Health Literacy Month was created by Helen Osborne. Okay, so ways that you can help them celebrate Health Literacy Month is libraries can celebrate Health Literacy Month. There's plain language in healthcare, what lawyers need to know about health literacy. So Health Literacy Month is a time for organizations and individuals to promote the importance of understandable health information. Let me see before I continue if I can just turn it down just a little. Sorry, guys. My apologies. Okay. This annual worldwide awareness raising event has been going strong ever since Helen Osborne founded it back in 1999. Let's see. Give me one quick second. Oops, my apologies again. Let's see. Okay, cool. Hopefully you guys can hear me. So again, it was founded by Helen Osborne, founded in 1999. If you like to Google her, I suggest or recommend that you do so to find out more about her. Over the years, healthcare organizations, community services Health literacy coalitions, government agencies, literacy programs, universities, and many others have hosted a wide range of Health Literacy Month events. These include how-to workshops for professionals, wellness programs for patients and the public, and educational offerings for students at all levels. The theme for Health Literacy Month is Be a Health Literacy Hero. It's about taking action and finding ways to improve health communication. Health literacy heroes are individuals, teams, or organizations who not only identify health literacy problems, but also act to solve them. So you can help by recognizing and cheering on those you consider as health literacy heroes by clicking here. So I am attaching the website for future reference. Okay, so for more information plus tools to help. And it's just thanks for doing all you can do to improve health understanding. So happy Health Literacy Month. So I just want to see how libraries can celebrate this awareness. Let's see if it's going to bring any good information up. So again, October being Health Literacy Month awareness. So health literacy is bigger than any one person, profession, or program. It takes all of us working together to improve health understanding. Again, that includes those who are working at, overseeing, and visiting public libraries. So this says, I have been focused on health literacy for many years, bringing to this field my experience as a clinician, training as an educator, and perspective as a patient. From all these perspectives, it is clear that there is much work yet to do when it comes to clearly communicating about health. Your library can help. So here are some of the ways. Because I say never sleep on libraries. Get a library card. Even if you think that's corny, get a library card. Libraries stay open a lot of times based on the grants, the fundings, the programs that they have. When you can fit it into your schedule, a lot of times libraries have activities and different events going on 6 to 7 days out of a week. Get your children involved if you have some, or just if you don't, get children involved in the libraries. There is a wealth of information in the libraries. So for those working at public libraries, you are at the very center of the intersection of health information and the public's desire to learn. Your skills are key to helping patrons find relevant, readable, credible, up-to-date health resources. I hope your library offers an array of materials, including some that do not require a lot of reading or advanced computer skills. These can include resources such as videos, pictures, models, and interactive games. Okay? And I'm just reading that a little bit because there's just so much to read. So, for those visiting libraries, we likely all have had the experience of being a patient or caring for someone who is. Sometimes this experience can be frustrating, such as when a clinician uses unfamiliar technical words, right? Because a lot of physicians or clinicians use a lot of big words that common people may not understand what they are, can't spell them, and that doesn't mean that you're slow or stupid. That just means that they're due to them with all of this education, they use a lot of big terms that people just don't understand. That's why you have to educate yourself, people. Because if you don't understand something, please don't feel like you are slow or special. And, Ask questions. If you don't understand it, tell them to break it down in terms that you are able to understand it. And then take notes on things. Write information down. Don't just keep it in your head. So again, sometimes this experience can be frustrating when a clinician uses unfamiliar technical words and doesn't take time to explain what those words mean. Happily, sometimes our healthcare experiences are good, like when a clinician shows, not just tells us, how to use a new medical device. And again, if you have to use devices either for yourself or for someone that you're caring for, ask so both of you are familiar with it. Even better is when this clinician watches while we try using this device on our own. These experiences, both bad and good, can serve as important reminders about why health literacy matters. Learn ways to communicate clearly about your own health. One way is by bringing a list of questions to each medical appointment. I had to learn that. It took years, actually. I mean, it's not that I guess I can say I did kind of start off briefly, not asking questions, and then I advanced up asking some questions, but ask. There's not a stupid question to ask. Ask it. That's what they're getting paid for. That is what they are there for. And if you are not satisfied with your clinician or professional person, you can request to get another doctor, physician, clinician, nurse, or whoever. It doesn't matter if they get into their feelings, because at the beginning and the end of the day, this is about your life and your health. And your health and life matters. Think ahead about which are most important. Along with my prioritized list, I bring a pen to write down the clinician's answers. Another communication tip is to confirm you correctly understand directions. So for instance, if the clinician says to take this new medicine with food, find out exactly what that means. Should you eat a big meal first and then take the pill? Or is it enough to nibble on a cracker when taking the medicine? I confirm directions by saying something to the clinician like, for instance, I want to make sure I understood. When you said to take this medicine with food, does this mean that I should fill in the blank? Since this article is about public libraries, another tip is to learn all you want to know about your health situation. And again, when you use the library or when you go to the library, that's why they have librarians there. Because for the most part, they are familiar. And if there is a question that you don't understand, or if there's something that you need assistance with, please don't hesitate to ask. And continuing, but please don't feel like you have to study everything. So make sure that you use these resources, because this is the platform for you to do that. And again, I encourage anyone to go to their local library. Yes, go to your local library. Get a library card. And when you can, definitely go to different things that they have there. I know I've been very fortunate, from Jersey all the way to Atlanta. I've gotten more involved with going to the library for different events. Actually, I was supposed to go this evening, but I had a bag and I just didn't feel like lugging that bag around, so I came in. However, there's a lot of activities that are going on in the libraries, and I'm going to utilize that while we are fresh in the month of October. They used to call me the little ambassador because I used to faithfully go all the time. But life changes, schedule changes, but when I can fit it in, believe me, I do. And I have enjoyed going to the libraries. So, Helen Osborne, who founded this back in 1999, again, she founded the Health Literacy Month in 1999. This annual event happens thanks to the hard work and commitment of thousands of health literacy advocates worldwide. Helen Osborne is president of Health Literacy Consulting, which is based in Natick, Massachusetts. As a speaker, author, consultant, and podcaster, Helen helps others communicate health information in ways that patients and the public can understand. Here are ways to learn more. So there is a health literacy consultant website. She also has a Health Literacy Out Loud podcast, as well as What's New in Health Literacy Consulting e-newsletter. So she does have information below that on how to contact her. There's also a Health Literacy Month handbook and health literacy from A to Z. So again, I have the link is posted. So if you're interested, by all means, definitely you can learn more. Knowledge is very important. Sharing the knowledge is very important. So health literacy heroes are individuals, teams, and organizations who identify health literacy problems and act to solve them. There are many ways to do this. So some examples of health literacy heroes that have done past good deeds, raise awareness about why health literacy matters, which has been organized and hosted more than a dozen health literacy conferences. Also create materials that are easy to read, understand, and use. Partner with communities and colleagues to advance health literacy. And you can help, and there are a lot of ways. You can encourage others to be health literacy heroes. There's names and contact information. You can also give an award to those you consider health literacy heroes. So I just want to bring that a little bit to you. Again, this is Health Literacy Month, which is going on the whole month of October from the 1st to the 31st, finding the right words for better health. So that was just my little bit this evening on that particular subject. I will be back momentarily to speak about another awareness for the month of October. Please join my social media outlets. Of course, I am here on Facebook currently. You can find me on Instagram, Twitter, LinkedIn, and I have a YouTube channel. And it's all under Aisha Speaks Jade. So as far as the YouTube, make sure that you subscribe and like and hit the notification bell for updates. Like and share and support, because I'm all about sharing and supporting from positive, like-minded people. Remember your self-care. Educate yourself. Anything you don't understand, ask. Write it down. Make sure that you're clear on it. Never say yes to something and you know you're not clear on it. This is your life. This is your body. You have one body. You have one life. And while you're here on this planet, make sure to educate yourself. Do it for yourself and do it for others. If you're taking care of someone, caregiver, caretaker, make sure you're familiar if you have to use medical devices or take pills. Make sure that you educate yourself, and always know that if you're not satisfied with that physician or clinician or nurse or whomever, you can get a second opinion, as well as you can get someone else to work with. Take care of the top of the crown of your head to the soles of your feet. Know your worth. Self-care, self-care, self-care. Can never say it enough. Thank you for listening. The replay will be available shortly. At the top of my Facebook page, it has no ratings yet. I really, really would appreciate you guys if you can give me feedback under that. You know how most Facebook pages ask for, it has up at the top of it, you can give a rating or you can leave a comment about a product or a service. Well, that's what I'm asking you guys to do. So until next time, which is very soon and shortly, be good to yourself. Send in positive vibes and great energy with much gratitude. Namaste and Ashe.